As the world opens up to Americans, the U.S. has so far failed to reciprocate, banning entry for many foreign travelers and perpetually extending the closure of its land borders with Canada and Mexico.
We will be ready when it is the right time to consider reopening travel, and that'll be guided, as always, by the science and the public health.
For the first time, the White House has hinted what the future of entry into the U.S. might look like, including a likely requirement that all foreign travelers be vaccinated. Details about what kind of proof would be required and which vaccines would be accepted still have to be decided.
This is acknowledgement that there's really one way out of this pandemic, and it's broad vaccination by the entire world. You really do need to have some sort of minimum standards. Testing is not enough.
The explosive spread of the Delta variant in the U.S. has put any plans for loosened travel restrictions on hold for now. There are 60,000 COVID patients in American hospitals. CDC models suggest a continued surge of new cases in the range of 200,000 daily new infections by late August, driven by lagging vaccination rates in many states.
The biggest concern is that the virus will continue to mutate, and it will, and that it could become more deadly.
A vaccine requirement for visitors would land as domestic vaccine mandates ramp up. Los Angeles is the latest U.S. city to consider mandatory vaccination to access gyms, restaurants, and public buildings. New York City announced similar plans this week, all meant to encourage vaccination at home as the U.S. grapples with a resurging virus within its own borders. Jackson Proskow, Global News, Washington.